Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, Heart Failure's Hidden Truth Revealed, and trust me, it's juicier than your cousin's peach cobbler. What if I told you that heart failure doesn't mean your heart has failed you completely? I know, the name is absolutely terrible. It's like calling a broken arm limb catastrophe syndrome. Today we're debunking the biggest misconception that terrifies patients and their families, and frankly, it's about time someone set the record straight. Here's the deal, AD2, heart failure is actually a mechanical problem. Your heart becomes a weaker pump. Think of it like an old car engine that still runs but doesn't have the same horsepower it used to have. You wouldn't junk a classic Chevy just because it can't do 0 to 60 in 4 seconds anymore, would you? Your heart is still beating, still working, just not as efficiently as before. This is why I emphasize that heart failure is manageable, not a death sentence. Yep, entirely true. I can't make this stuff up. But here's what most people don't realize, and this blew my mind when I first learned it in cardiology fellowship. There are actually 4 distinct stages of heart failure, from A to D. It's like a report card for your ticker. Stage A means you're at risk but have no symptoms yet. Think of it as your heart saying, "Hey, I'm getting a little concerned about my future here." Stage B means there are some structural changes but still no symptoms. Many people live completely normal lives in stages A and B with proper care. We're talking about going to work, playing with grandkids, taking that European vacation you've been planning. Even advanced stages can be treated with medications, devices, and lifestyle changes that would make your head spin with how effective they are. Let me share a real example that'll make this crystal clear. I had a patient named Maria, a 68-year-old grandmother who makes the best tamales in 3 counties. She was absolutely devastated by her heart failure diagnosis. This woman literally thought she had months to live and stopped playing with her grandchildren. Can you imagine? She went from being the life of every family gathering to sitting in the corner like she was waiting for the Grim Reaper to knock on her door. But after we sat down and I explained that heart failure meant reduced pumping function, not heart stopped working forever and ever, amen, everything changed. She's now 2 years post-diagnosis, takes her medications religiously, walks daily around her neighborhood, probably gossiping with every neighbor along the way, and babysits those grandkids twice a week. Last time I saw her, she was planning a cruise. A cruise. If that doesn't tell you something about managing this condition, I don't know what will. So here's what you can do right now, and I mean literally after you finish listening to this. The key is early detection and consistent management. It's like maintaining that classic car. You don't wait until smoke is pouring out of the hood to pop it open and take a look. Regular cardiology checkups can catch problems in those earlier stages when we have the most ammunition to fight back. Simple blood tests and heart imaging can monitor your heart's pumping strength. We're talking about technology that's so advanced it makes science fiction look like stone tablets. Think prevention and management, not fear and panic. Now, if you're sitting there thinking you might have some risk factors, and honey, if you're over 50 and eating drive-through more than twice a week, we probably need to have a conversation. Maybe I should see you in the clinic. We need to talk. High blood pressure, diabetes, family history of heart disease. These are all flashing neon signs that say, pay attention to your ticker. Your action step is simple. If you have risk factors like high blood pressure or diabetes, schedule that cardiology screening. Don't put it off like you're avoiding your high school reunion. Knowledge replaces fear every single time. When you understand your heart's condition, you can take control of your health instead of letting anxiety run the show. Remember, heart failure might have the worst name in all of medicine, but it's not the end of your story. It's just a new chapter where you become the hero who takes charge. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.